Hello and welcome to the EMS Improv Podcast, where we engage, where we're mindful, we share or tell our stories. I'm Eric Chase. We're powered by GEMS. I'd like to thank the Warriors Rest Foundation for the use of their podcast studios and facilities this morning. They graciously allowed my guest, John Graham, to be here in this beautiful studio. And I'll leave a link in the bio about what Warriors Rest does for the community, first responders, etc., on the link to this podcast. Today, ladies and gentlemen, my guest is John Graham. He's had 27 years of experience in emergency medical systems from the HEMS staff standpoint, rural as well as urban. He's held many, many positions from early leadership positions to the chief of EMSA in Oklahoma City. John Graham currently has an affiliate role with EMS, working for an organization called Boundtree, which also does great work in the community to help mental health and for first responders. John Graham was graciously able to be here with us this morning to talk about kind of his career, some leadership opportunities, and maybe a little bit of mental health as well. We did see each other at a funeral last week for Katie McBride. I want to mention her name. A super light and human in this community, 7+ years or 8 years with EMSA specifically, one of my partners as well. And Katie, may light perpetual shine upon you. So ladies and gentlemen, without further ado, John Graham, I want to welcome you and thank you for coming on the EMS Improv Podcast.
Thank you. I appreciate the invite.
So John, we did see each other at the funeral and I said, hey, you've got to come on the podcast. And it wasn't just because of the funeral, but it was the impetus again, because I saw you at another funeral. Unfortunately, this one was not where a person had taken their own life. They unfortunately had a significant medical emergency for which she succumbed to. We're seeing people too often at funerals where they've taken their own lives, John, and I know you've managed an organization, a really large organization in a big metro area where you've had to deal with that. And so kind of, I guess, just starting where we are, mental health as a leader, as a manager, how did you manage that, and what kind of pieces did you put together in order to help take care of people?
Well, I'd be lying if I said I did a good job at it. It's something that we've struggled with in EMS forever. I remember distinctly asking somebody when I first started, I was like, what do you do if you have, problems with a call or issues? And it literally, the quote was, nothing. You just cram it down, tuck it away, and we're on to the next one. And that generally works for a very long time until it doesn't, right? Mm-hmm. I had created a Facebook post last month. It was, Suicide Awareness Day for EMS. And when I posted that, I was like, over my years, I sent several people to counseling, to therapy, generally once or twice, whether it's phone or in person. I wish I would have sent so many more people, including myself. I didn't take care of myself. I didn't start going to counseling until a few years ago. And I've been out of the business for 4 years, and I wish I would have done it sooner. So I didn't do enough. None of us do enough, even the ones that are doing great things, because it is a huge problem. And I'll do presentations, or did previously, and the last 2 slides generally were, one, the names of people that have taken their own lives that are friends of mine or very close coworkers, not just somebody in the business for another agency. And that number is 12 in 30 years. And, unfortunately, I'll add another 2, 3, or 4. But with Warriors Rest, other programs like that, things you're doing in the EMS community is great. And maybe we can slow that trend on the way to stopping it. So it's very important. I wish I'd have done more. And one of the reasons I'm here.
Wow. First of all, I want to thank you. And hearing the number 12 for you, my number is probably 10 or 11 of friends that have taken their own lives, 2 last year specifically. And then countless EMS family. And I've worked in the law enforcement spectrum, military as well, and EMS and fire. So we're seeing it. I want to thank you for several things, for your leadership and your commitment to mental health, even outside of that organization now, and to to basically put yourself out there and be vulnerable and transparent. Say, you know what, I go to therapy. So I want to say thank you for that. I also go to therapy, and I have one of the most amazing therapists here in the metro area who takes care of a lot of people. And the biggest thing that she asks when we are taking care of other people is who's taking care of us. And she asked me that question 2 weeks ago. Well, who's taking care of you? And I had to think about it for a minute, because sometimes we get so immersed in helping others or listening to others that those cumulative kind of events, traumas kind of start working in on us. And you know, am I in distress or am I in dysfunction, and trying to learn and figure out where I can manage my life and what things I need to do to be better. So however it happened, John, and because we improvised and this podcast went there, we got pretty kind of heavy and understandably, sadly, dark, you know, talking about a funeral and the impetus for being there. And I want to come back to mental health, but the biggest thing is you have found opportunities to stay connected in your current position with Boundtree, to kind of interrelate and be associated with people that you've known. How does that help your mental health?
Oh, it does amazing things, right? You know, I probably would still be in a leadership EMS role if it wasn't for this position. I love EMS. It has been my career. It took several years for me to realize this is going to be my career, because we're only going to be here for a few years and then we're on to bigger, better things, right? But I'm still in the community. I get to see people that I've worked for, my mentors, people who worked for me, you know, across the state. And it's pretty cool to see people that I grew up with in EMS, and they have gone on to run their own ambulance services or fire, or they're involved in, you know, law enforcement. So when they handed me my work phone, I literally knew 85% of my customers personally. And the ones I didn't know, I'd heard of. So it was a nice, fairly easy transition, and I still get to be a part of the family. So it's been a lot of fun. It's harder work than I had anticipated. As I'm winding down my career, I joked and told my boss after he hired me, I said, you had me for 5 years, and then I'm month to month after that. So I'm 4 into 5, and we'll see, but I'll be around for a long time. And most of it's the people. I tell people I'm just a paramedic that sells stuff, and 10 minutes of work and 20 minutes of telling old war stories, and then I'm on to the next one. So it's been great. It's been a great transition.
Well, I'm glad that you've been able to have that transition. And when you said 85% or so of the people in that phone, your contacts, are people that you've actively been engaged with, you've known. That's, to me, what the impetus behind sales is. You don't have to market equipment because we need it. I want to have a relationship with the person that I'm getting our equipment from. You know, that you can literally call up, or I can call up and say, you know, from our organization, hey, John, the slip said this, we've got this, and, you know, well, let me look into it, you know, and within an hour, we have an answer as to where that item is or where it's going to be coming from. And if we don't know, it's less difficult to reach out. So I want to talk about the parallel of being able to reach out when you're in a sales position, a marketing position, and supplying us with the equipment, the tools that we need to take care of our patients. What do you think is the deterrence from me reaching out to you and saying, John, I'm struggling? You know, Katie died, you know, an officer in El Reno died. All these things that I'm thinking about, that I talk to my therapist about. Why don't I reach out to you when it's like that? And I'm asking you to kind of surmise, or maybe use your own feelings or emotions to tell me that answer. But what are some of the things that are holding us back from being that relational about our mental health?
I think it's history. It's just the history of EMS in general. That's not what we're known for. We're caretakers. We don't need the care. Part of it is, you know, you don't necessarily want to reach out to members of management. You might think that they will, you know, put you in a class or something, that there's something wrong with that individual, which isn't true. But it's hard. And to say it's not would be a false statement. You know, a position I'm in now is more of a friend or mentor or something like that. My phone is always on, always has been. And there have been a few people who have reached out over the years, right? But it's just not an open conversation like it should be. Now, it has certainly changed over the years because it really makes my heart feel good when I'd walk out into the bay and somebody says, oh, I got to go. I have to go to counseling, right? They just throw it out there. And people, probably after our generation, they're an open book on social media, out in the bay, things that I wish I and you and, people of our time and previous would have done that we didn't because we didn't feel like we were allowed to. We weren't taught that. We weren't shown how to do that. They do that now, and they reach out to each other. But, don't sell your leadership short when it comes to mental health. Certainly your friends and peers and things like that, because it is an open book now. We're not talking about as much as we should, but we're getting there. So always reach out, always.
So, and unless you're in a dysfunctional state, and we talk about mental health and working with people, we can be in distress after running a specific call. We can be in distress after something's going on within our home. The dysfunction comes when we start having behaviors where there's going to be an adverse consequence, whether it's at home or at work or the combination of the two. And we tend to then allow those to accumulate and pile up. When you and I were told, basically don't say anything as we were coming up, stuff it completely, I think you used those exact words a few minutes ago. From stuffing it to both openly admitting that we seek counseling and how beneficial we feel it is individually and can look each other eye to eye, kind of heart to heart, spirit to spirit, and saying, we wished, because so many of our friends and colleagues have not taken that step, or even if they had, maybe it was too little too late before an adverse outcome. When you as a leader have attempted to be pragmatic and have had friends or colleagues or acquaintances that you did certain shenanigans with, if you will, and then they come to you and say, well, John, remember this, or remember when you and I did X, Y, and Z, and you're trying to now hold them accountable, whether it's for their mental health or just because you have to hold them accountable because you're a field operations supervisor, you're the chief, whatever level of leadership and management you are, you're now holding them accountable. So bridging that gap from they knew you when to this is now, give the listeners and followers some insight as to how you navigated that, maybe some of the funny stories, and then also some of the more serious or impactful ones that you said, this one kind of caught me off guard.
Yeah, I came in young, as a lot of us do, and we do dumb stuff. And, when I had a person sitting across from me, a friend, a former partner, things like that, where we didn't necessarily mind the full rules and did some things, and some were dumb and, some were funny and were zero harm. Now, I will tell you, 100% of them were zero harm to the patient or the system, right? But they weren't necessarily within the rules. And as I would be mentoring, I like to call it, or disciplining, whatever you want to call it, I would get that. Do you remember when? Yes, I do. And my general comeback was, do you remember when we didn't get caught? Or more importantly, do you remember when we got caught but we told the truth? We admitted that we did that. And I think that's part of it. And I think that's part of being a good leader is you don't sweep it under the rug. You did it. You had witnesses, right? I mean, whether it's the person sitting across from you or somebody ancillary or whatever. But yeah, we did. We all push the rules. That's how we grow, right? I mean, that's as you grow up in family and in age, you push the rules. Some are egregious and you have to go, right? And there's no question and no doubt about it. But you admit it and you move on. And we're in different roles now, right? As you move up and you now become a rule enforcer or even a rule writer, some rules are written based on what I did.
Yes.
Well, we didn't have a rule about this, but we sure as hell should have.
So this is the John Graham rule at
right, right. So there's a few of those, and I think it's what it literally boils down to is being honest. And yeah, I do remember. And that's not why we're here.
And I like how you said, and that's not why we're here. And you know that I work in the yes and the improv space in applied improvisation. And also the big thing with Brene Brown is the dare to lead. And it, we have to be daring in leadership roles. And I've had employees come up to me on my shift or whatever and say, why did you make that decision? And are we going to have a supervisor that's off the truck because when there's an opportunity like this comes up and you have to address it, you just missed a call and we got 3 in a row. And, that's the 40, 50, 60,000 foot level. And depending on size of agency, scope, and abilities, we can't always meet their specific needs. And I think, like you said, the honesty, this is why, and I can't get into the personal or personnel issues. I can also tell you that there's something beyond the day-to-day that I was addressing or that you were addressing. And I was asked at one point to be less pragmatic, to try less managing and less allowing whatever's going to happen. And if this person said, if we get screwed this shift, we get screwed. And don't try to manage it, because when you're managing it, then I'm going to be upset with some of the decisions that you make. And they're like, I said, that makes sense, from a standpoint of you're going to be upset. And the more I do, the less you feel like you have the ability to respond appropriately without getting upset. So you've had employees get upset with you in the past.
Oh, yeah.
How do you manage that, from both a right here, right now leadership kind of and management kind of perspective, and then not letting that be a cumulative trauma that you've experienced or hurt, quote unquote?
Yeah, you hear them out, right? You hear, what is your concern? And while you can't speak specifically, like you said, about a particular incident or a person, you can give the rationale behind the decision. Yes. And it's hard as a leader to admit and to say, this rule or guideline we have is for the greater good. You're on the wrong end of it, and I'm sorry, for whatever reason, right? Mm-hmm. But you have to manage the greater good. The popularity does not come into it, because if you did, it's different rules for different people, and you can't do that. And it's hard, and because there are people, and I'm comfortable saying, for every probably rule, protocol, guideline, somebody's getting screwed out of it, right? In their particular situation. But, it's kind of, do you sacrifice the few to save the many kind of mentality? And unfortunately, you have to do that. So just being honest about it, and where the rub really occurs is, and what I enjoyed, no one likes to have hard conversations, right? But they feel good after you have them, even if they don't feel good. So it's hard. But when a person would come to me and ask me a very specific question about a policy or why something was done, and it wasn't, advantageous to the person sitting in front of me, they had an opportunity to speak and talk about it. It's the people that don't say anything, right? That they're holding court out in the bay without asking the questions is where the real struggle is. And you'll never make everyone happy. And if you do, and it's, probably a lesson learned for early managers, is you can't make everyone happy. And if you try, you're not fair. And it's going to burn you in the long run than it is to have that hard conversation.
And I hear burn you. I want to pivot for just a second. There's a picture in one of the offices here in the Warriors Rest organization's building here. And I saw it in a different building that Warriors Rest is in. But it's a bovine. I think it might specifically be a bull, or it might be a buffalo. I'm not sure. But it's got snow and ice and everything all over it. And I asked about that picture several years ago. And they said, the person describing it said, facing the storm is never going to be fun or easy. You're going to get the wear, the tear, the emotional, the physical strain and stress from facing it. the one positive and the biggest positive is that you're not trying to outrun it, because it's going to get to you anyhow, and you're always going to be looking over your shoulder and waiting for the shoe to drop or the consequence to happen or to get caught or whatever the case may be. And the natural kind of step is to protect ourselves, and why so many people avoid, lie, mislead, flat out, overtly lie, the sins of omission versus the sins of commission. And it's oftentimes the lack of integrity, the sins of omission, by not saying something as opposed to the commission of the action. Like you said, there's probably rules, John Graham rule, yet you were honest about it. And facing those things head on, kind of like that picture that's in this building kind of illustrates and alludes to, it's never easy. And yet you still talk about everyone seemed to feel better, both the person, you, me, and then the person that's in front of us. And sometimes we were the person that was in front of that leader. And by being given a voice and at least being able to express, not necessarily our why, not to rationalize it, but to be engaged in that conversation like you and I are having right now, there's something freeing about that. And I feel better just in the fact that we're having this conversation that's going to reach 1 or 2 or 3 or 4, and we're in the top 10% of podcasts out there as far as listenership and downloads. People are going to hear this. And because they're hearing it, John, I want you to think about whomever you need to speak to, whether it was your early self or that new manager that or that person that hasn't even considered their next step, and kind of give them a very simple blueprint of leadership and management today, where mental health should also be a significant focus, not only theirs, but the people that they're in charge of.
Yeah, I think it's commit, right? When you are offered the position of leadership, and it doesn't matter what rung of that leadership it is, it's step into it, do it. You have to realize a few things. One, you're going to lose some friends. And when I say friends, they're not friends necessarily. They're acquaintances. That's at work. The majority of the people there are acquaintances, right? Some are closer than others. There will be a few that, when you become the rule enforcer, that they're going to no longer be by your side. And that's okay. You have to accept that. In what we just discussed, the remember wins, right? Mm-hmm. You're honest about that. And you commit fully to doing it. And then if there's a point, whether it's 6 weeks, 6 months, or 6 years, that you're like, this isn't for me, you have to be willing to accept that as well. Trying to fake your way through doesn't work, right? I mean, it just doesn't work. And then trying to maintain those relationships that are going to be fractured or have been fractured because of your leadership role, your chances are you're not going to get those back. But if you feel that is more important, or leadership's not for you, is to go to your boss or your leader and say, this isn't for me. Is there something else out there, whether it's to go back to the field, FTO, or, maybe a different management position, to look at those. And, I had a couple scenarios where I was in leadership. My boss at the time had asked that I run a communications center, and I politely declined. And, and he was like, well, I'd really like you to do that. And I half jokingly, right, said, I'll take it, but I'm going to look for other opportunities. And I was more serious than not. And the reason was because that wasn't for me, because it's something that I'm not good at, the job itself. I'd never done it. I have done literally almost every job in EMS, from the materials position to chief of staff with the responsibility of 600 people. I never worked in the comm center because I'm not smart enough. My brain doesn't work that way. And I knew it at a young age in my EMS career, so I never did it. So then to be asked to lead those people for a job I've never done and couldn't do, I declined. Thankfully, I wasn't forced in that position, and I got to stay with the organization. But I would have looked elsewhere. And another time, I was put in charge of our tactical team, and I did it for a little while, and probably 6 months. And it wasn't for me. I'm not passionate about it. It didn't have my heart. So in a very hard decision to go to your boss, the one who asked you to do it, and then say, it's not for me, is very difficult, and probably stewed on it for longer than I was actually in the position. And finally did. I went and sat them down and said, hey, this isn't for me. It is not my passion. They need a leader who can, who wants to do it and be really good. And he told me that, that's a good sign of leadership. Mm-hmm. And I think the next day we picked somebody else and went on, and, not worse for wear, but the program itself was in way better shape because they had somebody with passion in it. So, knowing when to step up and go, and knowing when, say this isn't for me, is very important.
So, and I heard you specifically say both commitment and passion. So if you can commit to something full on and you're passionate about it, we are going to be more successful. Seeking opportunities to learn and grow, whether it be training, whether it be interviewing, whether it being a mentee to a mentor, asking questions. And I think that's the same thing that would happen in the FTO process and the education process. And it seems to me that once we get that person to our organization, we expect them to be able to do X, Y, Z, even though if we know logically and rationally that they can't, they don't, and this may be their first time, they're still learning the nuances of your organization, my organization, or whatever the case may be. And we put these untenable expectations on them, and we don't want to give them the grace, or even in many cases, and this is bad leaders and bad leadership, where we don't want to give them the growth potential and the growth opportunity to achieve and matriculate to the position that they hope to get to. And a lot of times we don't even care what they hope to get to because we just need another person to fill the space. And I'm not trying to be so negative about EMS, because you and I are both as positive as we can be under the circumstances, and in the awareness of knowing that we're all looking for bodies to fill roles and how they're going to be on our team and not be a toxic member and still can be their own autonomous selves within the organization. So I don't want to cast an aspersion across the spectrum or the bow of somebody that's saying, well, I'm hearing all this negativity. And in the event that we're talking, and there's somebody that's hearing a negative connotation out there, or they're hearing something negatively, oftentimes when we're in trauma, when we've been exposed to trauma, we hear with the trauma responses. We hear from the trauma that we experience. So we're using those things to measure all things around us, the negative connotations, the lack of positivity, the hurt, the pain, the guilt, the shame. So you and I can say something, and there could be 10 people in front of us, and there might be 10 completely different reactions to what we said based upon what is going on within their own psychological eustress or de-stress that they're dealing with. So with all that being said, when the people just don't get it, and you've said it 3 or 4 different ways, and you're giving them grace, and you're still the leader, you're sitting on your hands trying not to be imposing or intimidating, and you're a tall guy in general, so you could be seen as imposing or intimidating just because you stand over people. Kind of using your spirit, indwelling spirit, to let them hear it, and if they don't, then what do you do at that point?
You follow up, right? They don't necessarily hear it the first time. And it's kind of like hearing bad news or very traumatic news, right? You hear, we'll use cancer as an example. So when a physician tells you that, cancer or a loved one, you stop, right? Now your mind is rocketing somewhere else, right? Past, so-and-so I know had this kind of cancer or whatever. And meanwhile, the physician is still talking, but your brain is not there. So you're not hearing it. And I think that happens a lot in any business, right? And whether you're being disciplined, whether you're being told that, maybe you're not the right person for the job, here's where you need to improve. You hear something and then your mind is already headed in that way. So nobody gets one shot, right? I mean, it has to be, trained, and, you lead by example, and you show different ways and things like that. And eventually, if they don't get it, then you have a little track record of, well, here's what we've done. We've discussed it here. We discussed it here. We gave you this. Here's this opportunity and things you don't. And several years ago, we had a Chick-fil-A of all places. We had a gentleman come in and kind of do a customer service talk for our inside folks that do billing and things like that. And, he started off with, when somebody says, thank you, what do you hear from us at Chick-fil-A, right? They don't say, you're welcome, right? Mm-hmm. They have their little catchphrase that they say, and he says, a lot of people can't say it. It just doesn't work in their brain. And if it doesn't work in their brain, they're soon promoted to customer. And it took a second for that to hit me, like promoted to customer. Oh, they no longer work there, right? Mm-hmm. They're now a customer. Yes. And I think a part of that is applicable to any scenario, that if they just don't get it, as long as they've had the opportunity to improve and learn and train, you promote them to customer. And as long as you've done it correctly and fairly, then everybody should be able to rest easy while very uncomfortable. And, I've kind of done that. And I've had my moments of very poor leadership. Yeah. I didn't take off and was good at it in the beginning. And I'm sure there's people out there who think I'm terrible at it. And, which is fine and probably fair, because I've had my moment. And thinking back on some things over the years, I'm like, ugh. I did not handle that well. Mm-hmm. I would handle it different, but we all grow, and some single person has that, whether it's, they're starting in the field. I wish I'd have done this differently. Probably if you're not doing that as a clinician, every call, you're probably not where you need to be, right? Because we're always learning, and what could I have done better? And it's just, but sometimes it means more, certainly if it involves patient care or somebody's livelihood.
I'm going to make a joke too. What about the SEC where it just means more?
Oh, man.
And I know you're a big OU Sooners fan, and this is their second year in the SEC. So just a quick aside, but it just means more. John, you said three things that really resonated with me. And before we start wrapping it up, I wanted to touch upon three of them. And I want to tell you, like, eye to eye, face to face, I'm so grateful for this experience right now. You've given me three learning pearls, or took me to a place in my mind space that they're lined out ready for me to have been doing. I needed the spark or the impetus to connect to them. So I want to say thank you, because here's the three things. In 2010, I was told I had cancer, and I stopped hearing everything, literally, to what you specifically pointed out. And using that as the specific point to get the message that I needed to hear, whatever the listener out there needs to hear, whatever your why is, we're asking you to give yourself grace simultaneously. It took 15 years until John just said that this is the kind of leader and the person I need to be at home, with my grandkids, with my children, with my wife, with my employees, with my bosses. I have to give them grace, and they're going to say things that I'm going to tune them out, and they're going to tune me out. And we just have to understand that. So firstly, for that, thank you. That right there alone, if I take nothing else from me today, I have to remember that there's things that I say that they're going to tune out, and then I have to pause. And that's one of the things that I'm learning here at Warriors Rest Foundation, is to give people space for the conversation, for them to feel comfortable to share, the brave space or the safe space to share. So that's one. I want to thank you, John. Two is talking about admitting that you've made some woefully horrible and inadequate choices, and there's nothing we can do about that today. And at the same time, the person that heard you, or the person that's going to listen because they want to hear what kind of a jerk John is, and then realize that you're a human being. Hopefully, two, and that's number two, we all can grow through these things. And we hope and pray that any of them that had those adverse interactions with you or me are doing much, much better than they ever could have been, in spite of us.
And you know what? And I've done that, right? And if that still weighs on anyone's mind, I want to hear from them, right? I want the opportunity to apologize and how maybe we'd do things different. If that weighs on them, I want to know about it. And that goes for home too, right? I did that in my home. Mm-hmm. And so so don't be afraid to reach out.
Safely, and if you intend any harm or violence, then just stay away. And I got to put that disclaimer because right. Some people are like, and then the last thing is just opening up the dialogue. I've grown just in the last 40 minutes that we've been talking, and it's either reaffirmed in me decisions to continue to do things a certain way, or to say, you know what, I was vacillating or questioning this anyhow. And John's pearl of wisdom or his experience just said, you know what, I don't even have to go open that door, because on the other side is going to be more heartache, hardship, and difficulty. So let me just keep that door shut based upon what you said. We don't always have to test the stove to see that it's hot. We're not children anymore. We're not going through those formative years in child psychology where we have to learn by the reaction that we viscerally have. Listen to the pearls, commit, and be passionate, John's saying. And in the last couple of minutes, John, I want to give you just an opportunity to kind of close out. We started pretty heavy and kind of dark. We went through some humor and still, I think, maintained a pretty serious tenant. You just gave an opportunity for people to reach out to you if they're still holding on to something. And I think that's a beautiful sign of humanity and true leadership, and that kind of honors that person. And with that being said, I want to give you the last opportunity to say what you want to say.
Thank you for the opportunity. This is great. I love still being a part of the family. I miss EMS every single day. Would I go back? It'd be a discussion with my wife, of course. And I do miss it. I miss it so much. I miss the people. I miss, the camaraderie we have with everybody and the fun. While it is a very hard, very difficult, physically, mentally, not only on you but your family job, it's a great job. And I'm hesitant to tell people that aren't in the circle I love my job. I had so much fun. Right. And what do you mean you had fun? Running these calls and taking care of these people that were sick and injured. And it's just, it's what I wanted to do and what I was pretty good at. But really, I just want to tell people, be open, be honest. If you're struggling, any issues, concerns, things, reach out to somebody. There's somebody out there. And even if your brain is telling you repeatedly, there is nobody out there. There is. There's 211, there's phone numbers, there's 911, there's, you and me and Warriors Rest. And I'm blessed to work with such a great company in Boundtree because they take care of people. So they're very invested in EMS and pre-hospital mental health for police, fire, and all that. So it is a thing that people are comfortable with. And if ever you struggle, reach out to somebody, because somebody is out there. And I want to repeat it. No matter what your brain is telling you, there are people, right? So reach out. But I appreciate the time to come on and talk to you and, answer these questions, because like you said, if 1, 2, 3, or 4 people grab one little thing, whether it was just us kind of joking or something very serious, I appreciate the opportunity.
Well, I'm grateful for you being here. The third thing that I kind of skated over before we do our outro, I was FTOing an employee a couple weeks ago, and I said, can improve, and whatever else I specifically wrote. And there was an immediate, and I told this person by first name. I said, if I was FTOing myself today with 20 years of experience, I would still write can improve. And I just want to say thank you for that. Was the third thing that I wanted to specifically address, other than just saying that you brought light to some things that I've been harboring or stuffing down. I can always improve.
Oh, well, yeah, this podcast could definitely improve. That's
You're 100% right.
Yeah, I mean, yeah. And you're exactly right. We all have room for improvement, man. That's what it is.
So my guest has been John Graham. Ladies and gentlemen, commit to what opportunities you've been given or want to take. be passionate about them. And when you can't do one of those, it's time to consider another options. This is and has been the EMS Improv podcast, where we've engaged, where we've tried to be mindful. We shared and told some stories. I'm Eric Chase. We're powered by the Journal of Emergency Medicine, aka GEMS, and may a peace which surpasses all understanding be with each of you into the new year, 2026. Thank you.